सीमा बल श्री अमृत मोहन प्रसाद, अपर महानिदेशक महोदय, वरिष्ठ अधिकारीगण, यहाँ उपस्थित सशस्त्र सीमा बल के सभी साथी तथा वर्चुअल माध्यम से जुड़े सशस्त्र सीमा बल की विभिन्न इकाइयों से हमारे सभी साथी, आप सभी का चिकित्सा एवं स्वास्थ्य से संबंधित एक और विशेष कार्यक्रम में आप सभी का हार्दिक स्वागत और अभिनंदन करती हूँ। महानिदेशक सशस्त्र सीमा बल की प्रेरणा एवं मार्गदर्शन में आज एक बार फिर से जवानों के बेहतर भविष्य एवं उत्तम स्वास्थ्य से जुड़ा एक और कार्यक्रम का आयोजन किया गया है और जिसके लिए हमारे साथ एक विशेष अतिथि बेंगलुरु से वर्चुअल माध्यम से जुड़े हैं। पद्मश्री, पद्म विभूषण और अन्य कई प्रतिष्ठित पुरस्कारों के प्राप्तकर्ता डॉक्टर देवी प्रसाद शेट्टी, फाउंडर एंड चेयरमैन नारायणा हेल्थ बेंगलुरु। आप एक मशहूर कार्डियो सर्जन एवं FRCS एक भारतीय उद्यमी हैं। डॉक्टर शेट्टी ने भारत में बाल चिकित्सा कार्डियक सर्जरी का बीड़ा उठाया है, जो एक उनका प्रेरणादायी यात्रा रहा है और जिसका जिक्र नेटफ्लिक्स पर मौजूद डॉक्यूमेंट्री द सर्जन कट में शामिल है। सर, आपका बहुत बहुत स्वागत और अभिनंदन। सशस्त्र सीमा बल से आपके साथ वहां मौजूद हैं कमांडेंट चिकित्सा डॉक्टर गौरव मिश्रा और अब डॉक्टर देवी शेट्टी। आज के इस सेशन के लिए आप सादर आमंत्रित हैं।
Thank you. With very poor knowledge on Hindi, please forgive me. First of all, I want to tell each and every one of you that I am a great fan of all of you. The kind of a work you are doing today to protect the lives of 1.4 billion of all of you. It's my privilege to share my knowledge in this area of healthcare on how to you all are taking care of, you are all protecting our lives. We want to advise you on how to protect your life. I would like all of you to celebrate your 95th birthday sitting on your own feet without a wheelchair, standing alongside your children and the great grandchildren. This is possible today with what modern medicine has to offer. But role of medicine is very small compared to what you are expected to do for a healthy life. I will advise you on very, very simple things what you can start doing today. My first advice to everyone is that all of you must wear a smartwatch. A smartwatch which gives you the number of steps you take and your physical activity. Today, there are large number of scientific articles which have analyzed the health of thousands of people over a period of 20, 30, 50 years. And came up with a conclusion that those who walk 10,000 steps every day live the longest, have the best quality of life. Incidence of diabetes is very low. Incidence of heart disease is very low. Even incidence of Alzheimer's disease is very low among the people who walk 10,000 steps every day. Now, most of you are physically active, but I can tell you that you will not be walking more than 3,500 to 4,000 steps every day, most of you. Now, if you have to increase it to 8,000 or 10,000, it is not that you have to walk 10,000 steps in the morning or evening. Every time you take a phone call, a mobile phone call, use the earphone and start walking while you are talking. That will easily give you at least 1,000 extra steps every day. And lot of us are spending lot of time on the chair. Sitting on the chair is worse than the cigarette. But our job and the lifestyle is such that we have no choice. We have to be sitting on the chair most of the time. But every hour, I would like you to get out of the chair in your own office or whatever space is available. Walk for at least 5 minutes to 10 minutes. Look outside at the horizon. Especially people who keep looking at the screen in their desktop. It is very, very important for you to look outside to the horizon. That will rest your eyes. And by walking, you re-establish the circulation in your body. So the important advice I have for all of you about a smartwatch, and these smartwatches also give you the ECG. With the 2 taps you can check your ECG, and it is a matter of time before these smartwatches will give you a blood sugar level and kidney function level, most of the other features. It cannot be there now, but it will happen soon. So I would like you to embrace the concept of having a smartwatch at a very early stage in your life. The next advice I have for all of you, irrespective of how fit you are, is to embrace yoga for at least half an hour or 1 hour, at least once in alternative days. I know as soldiers you are all doing your parade and exercises. All those exercises train the flexors of the body. That is your biceps, triceps, all the flexor muscle which shows. None of them exercise the extensors. As you grow older, reach the age of 40, 45, you will notice that your joints start paining, or once in a while your joints will remind you that it is stiff. In that kind of, if you want to avoid that situation, at an early stage, you should embrace yoga, which balances between flexor muscles and the extensor muscle. Joint pain is not because there is something wrong with the joint. Joint pain is because of the imbalance between the flexor muscles and the extensor muscle. Now, some of you must be wondering why this doctor is advising about the exercise. I just want to give you my background. As a medical student, I was a bodybuilder. I had very big muscles, and I won several prizes as a Mr. KMC and all kinds of competition. I know what bodybuilding is. I spent more time in the gym than in the classroom. When I reached the age of 55, as a surgeon, I needed to stand for a long time. I started getting pain in one of my knees, and it wasn't going away. And my wife told me that I should start yoga. And I started laughing at her, saying that yoga is not for a fit person like me, and it's only for the very old people. But the pain didn't go away. It got worse. As a surgeon, I needed to stand for 6 hours, 8 hours. Then I started becoming conscious of climbing steps. That is the time I realized I should start yoga. And believe me, just 3 months of yoga exercise, the knee pain completely disappeared. Today, if you ask me, which knee of mine was hurting that time. I have completely forgotten. Today, I stand and perform the surgery continuously for 6 hours, sometimes 8 hours. When my junior assistants, who are my children's age, need a break in between, but I can stand continuously. This is only because of the yoga I embrace wholeheartedly. If this has made such a big impact on my life, I strongly recommend that all of you should embrace yoga at a very early age. I took it at a late age. It's never too late in life, but this is one of the best medical aid I can recommend to all my patients. Then, next thing about the food. There is lot of misconception and beliefs which are found to be not true. All along, first of all, you are what you eat. That is the first thing you should remember. It is very, very important to choose what you eat. All through my life as a young medical student, doctor, and a senior doctor, we blame the oil for the mischief played by the carbohydrate. This is the biggest regret I have. All along we said, this oil is good, that oil is bad, don't eat too much of oil, oil is bad. But the real mischief in your body is not played by the oil, it is the carbohydrate. What is carbohydrate? This is rice, chapati, and sugar. Basically, from the childhood, our meal consisted of large quantity of rice and small quantity of vegetables and hardly any fruit. This has to change. You have to make a conscious effort to reduce the quantity of rice, chapati, and sugar. Because most of the problem we see in our own body, whether it's obesity or a heart problem or any of the diabetes and all these problems, are because of excessive intake of sugar or carbohydrates. So it is very, very important for us to supplement with large quantity of vegetables. Fish and chicken is very good for health, no problem. Egg again is not bad, but red meat I wouldn't recommend. So my suggestion is to have more of these than the rice, chapati and sugar. Vegetables in large quantity is extremely good for your digestion as well. The other advice I have about your diet, most of us Indians, even though we live in a tropical country where the weather is hot most of the time, we do not drink sufficient water. It is extremely important for you to always have 1 glass of water on your table all the time. Otherwise you'll forget. Like I'm sitting and talking to you, in front of me there is 1 glass of water, and every time I finish drinking it, my secretary will bring a fresh glass of water. So at least 2 to 3 liters of water as healthy people, as long as you have no heart problem or a kidney problem, will make a huge difference. Especially people who had 1 bout of urinary tract infection. If you had 1 bout of urinary tract infection, you will never forget that experience. It is a very painful condition. And These people, if they start drinking water, they will virtually never get urinary tract infection. And also, if you have a tendency for formation of the renal stone, kidney stone, it helps a lot for you to drink plenty of water every day. Now, how do you know that you drank sufficient quantity of water? All you have to do is, after passing urine, look at the commode, and if the commode water looks like water, you have drank enough quantity of water. If the commode water looks yellow, that means you need to drink more water. That is a rough indicator about the hydration status of your body. Especially people who are slightly obese, trying to lose weight, I can tell you that if you do not drink sufficient water, it is very hard for you to lose weight. It is very hard to lose weight. So drinking water will also help. Then when you reach the age of 45, 50, it is not uncommon for you to start getting muscle ache, especially the joint muscles around the joints. This happens because when the body water goes down, your ligaments and the cartilages have less water. That becomes stiff. If you drink water, all these muscle pains and everything will disappear. This is my advice about the water, especially people who want to lose weight. Now, obesity is a big problem in India because of our diet of high carbohydrate content. A lot of people want to lose weight, but it's very hard for them to lose weight. Today, there are medicines which have come to market which can reduce the weight dramatically over a period of 3 or 4 months period. The safety of these medicines are not yet proven without any, it's a too short a time. But I can tell you that the way this world is consuming this medicine, millions and millions of people living in this world are consuming this medicine. If there was a serious side effect, by this time, it would have been known. I'm not saying it doesn't have the serious side effect, but I would like you to discuss with your endocrinologist about taking this medicine at least for 2-3 months to get the initial break of losing about 10 kilos of 8 to 10 kilos of weight you lose first. Then that will inspire you in your journey to lose weight. You need a break. It is very easy for a person like me to tell people that you all have to lose weight. It is the most difficult thing to lose weight because some people, they have a tendency to put on weight even if they eat less. Their genetic pattern is such that it's very hard for them to lose weight. So I would like you to consult your endocrinologist to get the benefit of these medicines. The next advice I have for all of you is that starting from the age of 18, you should know your numbers. What are the numbers? You should know what your blood sugar is at the age of 18. You should know what your cholesterol level is at the age of 18. The Cardiology Society of India has strongly recommended that 18-year-olds should know their cholesterol level. Because when you know your cholesterol level is high at the age of 18, your chance we can convince you to avoid the junk food, which will cause obesity and future problems. Everyone should know their numbers, what those numbers are, especially when you reach the age of 30, 35, 40. You should know your body weight. Just want to let you know that 18% of the 20-year-old have high blood pressure in India. 18% of the 20-year-old. So if you have not checked your blood pressure, please check it. And if you have checked it, check it every year. Everyone should know their blood pressure. Everyone should know their body weight. Everyone should know their blood sugar level. Your kidney numbers, urea, creatinine. These are the thyroid profile. Everyone, every Indian should know their thyroid profile. I just want to let you know that I'm the 8th of the 9 children. My entire family is hypothyroid. Thyroid function is poor, and it won't cause any problems in the short run. So it's very, very important that you all should know your thyroid profile every year. And I want, past the age of 35, 40, all of you should know your calcium score in the CT scan of the heart. It's hardly take 2 seconds. You go in and out of the CT machine, that will give the calcium score. Because that is the early indication of blockages in the coronary arteries. I know that your test comprises of a stress test or a treadmill. Stress test or a treadmill becomes positive when the blockage is over 70%. We want to know when the blockage is 5% or 10%. Then we can treat you and advise you on how to prevent the progression of the blockages. So I strongly recommend all of you, past the age of 35, 40, at least once in 5 years, once in 10 years, get a calcium score in the CT scan. I would like the people with the medical records, some kind of a medical history. I would like you to have all your medical records in your own phone. Because today we keep traveling, especially your ECG, your chest X-ray, the blood test, everything should be in your phone. So it is with you wherever you go. Today people forget their spouse, but they never forget the phone. So the best place to keep your medical data is in your own phone. Now, you must be wondering why I am talking, you're all healthy, fit people. Why am I talking about getting all the tests done? There is a reason. Because I want to tell you something which you may not like to hear, but it is my duty to convey that statement. How fit you feel has nothing to do with how fit you are. You may climb Mount Everest twice in a month and tell me that I am a fit person. I will congratulate you, but I will never certify you as a fit person. To certify you as a fit person, I need the data. All the numbers I spoke about. Now, you still have doubt about my statement. All of you have a smartphone. When you go out of the hall, go to Google and type FIFA, Federation of Football Association, International Football Association, FIFA. and then you write cardiac arrest. Then you see series of articles of 676 professional footballers having heart attack during the practice session in just 4 years. In 4 years, 676 professional footballers had a sudden cardiac arrest. This is what is documented. Undocumented will be 10 times more. Tell me, who can be fitter than a professional footballer? If they can have a sudden cardiac arrest, none of us are an exception. Every other day, you see in the TV some film actors, celebrities, footballers, badminton players suddenly collapsing. Then the next day the paper says sudden cardiac arrest. Do you know, without an exception, if all those people 10 years earlier went for a health checkup, got the test done what I have just mentioned, none of them would have developed a sudden cardiac arrest. None of them, without an exception. Nobody develops a sudden cardiac arrest with a normal heart. It can't happen. They had some type of a problem that could have been detected 10 years earlier. Now, I couldn't have made this statement 20 years earlier because the tools for getting this data from your body were not very good. They're not very accurate. Today, the tools what we have to know your status of the health, the CT scans, MRIs, echocardiogram, those images are 1,000 times better than what I can see with my naked eyes when the heart is open inside. The images what I see is 1,000 times better than what the machines can show me in the screen. This is the beauty of healthcare. Now, why all these problems? Forget about your health. You're healthy people, God will keep you healthy. Let's look at India. Every day, before 7 o'clock in the evening, few thousand young people develop sudden cardiac arrest, and 10% of them will die. Every day, before 7 o'clock in the evening, few thousand people across the country are told that they have advanced cancer for which there is no cure and they are going to die. 33% of the deaths are due to cardiovascular disease and 7% of the death are due to cancer. 50% of the deaths can be prevented just if these people went for a checkup 1 year earlier, 365 days earlier. If they went for a checkup, none of them would have had a heart attack. None of them will be diagnosed with end-stage cancer. They will be told they have an early-stage cancer which can be cured. So today, we are in a position to prevent 50% of the deaths, what I call as the needless death. This is the beauty of technology, and this is what we have to offer. Now, my last message to all of you is that many of you look at your relative of yours, neighbor of yours, friend of yours, who drank like a fish and smoked like a chimney and he lived till the age of 95, nothing ever happened to him. Then why do we have to do all this rigid lifestyle? I'll give you some data which is not very accurate but more or less easy to explain. Why you have to look after your health, why you have to exercise. 25% of the population have a very strong family history of heart disease. No matter what you do, they will develop the heart disease. About 25% of the people, another 25%, have a very strong genetic protection. They can smoke like a chimney, they can drink like a fish, they will never die. Only way they will die is you have to shoot them down. But 50% of the people are the fence sitters. If they lead a regulated life, they will reach the age of 70, 80 without having heart problem, without having cancer. But if they don't take care of the health, they land in trouble. So my advice to all of you is to think that you are a fence sitter. You have no idea which category you belong to and follow a disciplined life. This is my advice to all of you. And once again, I am extremely grateful to you for giving me the time to interact with you. Thank you so much. Yes, please. Yes, please. Yeah.
Sir, thank you very much for a very, very invigorating and motivating talk. I just wondered that whether you have got time, spare time to take questions from our people.
Yeah, please, please. I can take few questions. Yes.
हमारे दूर दराज चौकियों पर बैठे हुए जवान, अगर आपको या वहाँ उनके साथ रहते हुए बटालियन वाहिनियों में डॉक्टर्स जो हैं, पैरामेडिक्स हैं, उनको कुछ सवाल करना है तो इससे सुनहरा अवसर और कभी नहीं मिलेगा. बोलिए. Sir, I think they are hesitating, and I'll take the liberty of. हाँ बोलिए बोलिए.
गुड मॉर्निंग सर.
हाँ बोलिए.
मैं सडन कार्डियक अरेस्ट के बारे में जानना चाहता हूँ सर. व्हाट इज द प्रिस्क्रिप्शन एंड अर्ली इन्वेस्टिगेशन वी शुड डू सर.
Yeah. My advice for anyone to prevent sudden cardiac arrest is to go for a preventive checkup and get the basic tests done. All these tests can be done in any of the hospitals in less than 60 minutes to 90 minutes. And most of the tests need not be done every year. Blood test has to be done every year. Other tests can be done once in 2 years or once in 3 years. Some tests can be done once in 5 to 7 years, especially CT scan. But once you do those tests, we'll be able to protect you from all these sudden cardiac events.
Thank you sir.
Thank you.
Sir, if I take the liberty, on behalf of all the medical officers and the paramedics, what would your advice be to them in order to take better care of the force personnel?
Yes, the simple thing is those who have a family history of heart disease should be screened in detail. Today, a lot of them will know who are the family members who had a problem. That is the first thing. Then others with the raised cholesterol level or blood test can be done. You have a decent facility in most of your outposts. If the blood test can be done to know their cholesterol level and the blood sugar level and the kidney function. If these three things are done with the young people, they are okay. And a lot of your places have a ultrasound, which can be used like a echocardiogram or the ultrasound. These are the simple tests you all can do it. wherever, and the ECG I'm sure is available everywhere. So you have to make it mandatory that whatever the tests are available in your centers, if it can be done, so, and a document is kept that, in the central registry that people have undergone the test, because there is a mental block by everyone to go for the checkup. Even if it is free, even if it is painless, the idea is they think that if I go for the test, they will find something. So my idea is to make these things mandatory for your people, especially those who are at the front end. With the tools what you have, they don't need to go some other big hospital for all the tests. Most of it is available in your own hospitals. Yeah.
So this is from Nanak here. This is a hilly station. I have one common question. Before that, thank you very much for your lectures. We have we are hearing this lecture will be helpful in the motivation of the all troops in the field visit. And so one question from my side is the consumption of alcohol is very common nowadays because of the many functions and others and all types of functions. So in regards of consumption of alcohol, how much danger it is and how is safe up to which type of quantities? Will you elaborate a little about this?
Yeah. First of all, cigarette in any quantity is bad. I strongly recommend that you all should work to see it's very easy for people like us to say, stop cigarette. Addiction to tobacco is extremely hard to come out, and there has to be some kind of a counseling for them to reduce and eventually stop. Alcohol, once in a while is okay, but alcohol regularly is bad, and alcohol in large quantity is definitely bad for most of your organs. So my recommendation is the kind of a lifestyle you all lead. Saying that alcohol is not allowed won't work, but at least you can restrict the quantity of alcohol which can be served during any of your meetings to a particular individual. And this is something, because alcohol in moderation is okay, but that moderation is maintaining it's a bit hard. So this is my advice.
Thank you, sir.
थैंक यू सर। आपके द्वारा दी गई सभी जानकारी निश्चित रूप से सशस्त्र सीमा बल के प्रत्येक जवान के लिए लाभकारी सिद्ध होगी। आपका एक बार पुनः बहुत बहुत आभार।